Dear students, welcome to EPG Pathshala. This is Dr. A.G. Sinha, a professor in the Department of Physiotherapy, Punjabi University, Patiala. In this module, we are going to talk about the elements of safety education in sports. In the recent year, the participation in sports activity has increased because of a rise in the incidence of inactivity-induced diseases. Participation in sports and physical activity offers numerous health benefits. Sports participation has emerged as an important public health strategy to prevent a number of disorders associated with inactivity. Participation in sports is itself associated with risk of injuries. The risk of musculoskeletal injury is very high in the sports participation. These injuries often carry significant price tag in terms of man, money and motivation. An untimely injury may prevent a player from participating in an important national or international competition. Many athletes train harder for a year, but they cannot participate in the competition because of a minor injury occurring just before the competition. In order to enjoy benefit of sports, it is important that sports and physical activities are conducted in safe environment. A safe environment provides an opportunity to develop physical skills and also opportunity to enjoy the excitement of sports. All these makes prevention of sports injury an important public health issue, and the International Olympic Committee is now placing increasing emphasis on protection of the health of athletes. Friends, the focus of this module is on the prevention of injury. When we talk about safety and safety education in sports, we actually refer to the measures which leads to the prevention of sports injury. In this module, we shall talk about the causation of sports injury, the factors that increases the risk of injury, and in the last, we will discuss about the methods to minimize the risk of injuries. The role of specific safety rules in reducing the incidence of sports injury shall also be discussed. Injury is the occupational hazard of a player. Almost every player sustains some injury on and off the field in his lifetime. But there are many players who, despite having good performance, are unable to secure a place in the team due to injury. Therefore, every player should know how the injury is produced, what makes a player vulnerable to injuries, and how we can prevent the occurrence of injuries. The best person to impart this basic safety education are the coach and the trainer. The physiotherapist and doctors, they often come across the injured player, and they should also devote some time to educate the player about the steps through which a player can minimize the injuries. Sports injury is a disruption in the tissue resulting from a mechanical force that exceeds the structural strength of tissue. Since sports are the pursuit of physical excellence and prowess, athletes are often subjected to a variety of external and internal forces far greater than those encountered in day-to-day activity. During running, jumping, landing, fall to the ground, collision with players and equipments, a very high external force is imposed on the body. Many athletic maneuvers such as throwing, jumping involves powerful muscular contraction and generate a very high internal force. When the force is concentrated to the specific area, it produces damage. If the applied forces is dissipated to a larger area, the injury can be avoided. When we realize that a sports injury is the disruption of tissue resulting from the forces far exceeding the structural strength of the tissue, it becomes easier for us to think about the method of their prevention. The factor that makes the most powerful impact on the ability to withstand higher forces of sporting activity is the training-induced adaptations. In response to gradually progressing training load, the body adapts and the structural strength of tissue increases. The factor that makes the most powerful impact on ability to withstand higher forces of sporting activity is the training-induced adaptations. In response to gradually progressing training loads, the body tissue adapts and their structural strength increases. Therefore, sportspersons are able to withstand the higher stresses of competition comfortably. However, if sufficient time is not given for adaptation and player is forced to participate in the activity, his chance of sustaining injury increases manyfold. The structural strength of some areas of body get reduced due to degeneration, disease, or imperfect repair of previous injury. Application of even a normal force can produce injury to these tissues. Sports injury is the result of interaction between imposed forces and the capacity of body to withstand the forces. There are many factors that reduces the ability of body to withstand higher forces. These are called the intrinsic risk factors. The situations that increases the chance of exposure to higher forces can be termed as extrinsic factors. When the intrinsic and extrinsic risk factors act simultaneously, the athlete is at far greater risk of injury. Intrinsic risk factors are the physical and psychological characteristics of the athlete that make them vulnerable to injuries. The factors such as mechanical imbalance, biomechanical misalignment, instability, imperfect neuromuscular coordination, previous injuries, lack of fitness, skeletally immature, certain age group, female with menstrual irregularity, and the psychological makeups are the known intrinsic risk factors. Biomechanical imbalances are the known causes of sports injuries. Factors such as reduced flexibility, joint laxity, muscular weakness, imbalance of muscular strength, proprioceptive deficit, and malalignments can be termed as biomechanical imbalances. These alters the distribution of force in the kinetic chain of movement, increase the chance of concentration of forces in the specific area, and increase the risk of injury either locally or at distant site. Restriction of joint range of motion is a known factor contributing to both acute strain and overuse injuries. A decrease in joint range of motion potentially reduces its response to sudden demand. The decreased extensibility of connective tissue mechanically hinders the amount of joint excursion and decreases the efficacy of movement pattern. Forcing a joint to move beyond the available range produces macro and micro trauma. On the other hand, presence of excessive range of motion makes the joint unstable. Instability refers to increased movement within the joint due to disruption of stabilizing structures such as ligaments and capsules. This increases the risk of both overuse and acute injuries. To produce functional and non-stressful movement, there should be appropriate balance and synergistic co-activation of the synergists and the prime mover muscles. A change in the strength of one muscle alters the length and strength of other muscles also. This reduces the joint protection offered by the contraction of muscle and often leads to faulty muscle recruitment. This may culminate into the poor execution of technique, and the effect will be seen either locally or at the distant site. The contraction of muscle also helps to attenuate shock of impact, a function that is grossly reduced in the presence of muscular weakness, and this increases the susceptibility for strain and contusion. Ligament-injured joint display a deficit in proprioception. When the stress is applied to ligament, a specific pattern of neural activities are initiated for activating those muscles that are in anatomical and biomechanical position to oppose the applied forces. The lack of proprioceptive input reduces the amount of protective muscular activation and give rise to reduction in functional stability. It may also deviate the biomechanical axis of joint motion from its ideal path and alters the contact area of the articular surface. This leads to the abnormal compression and shear stresses and eventually progress to the frank injury. Athletes having good cardiovascular endurance are less likely to get injured. The poor stamina induces early fatigue that increases the chance of performing incorrect movement, and thus the chance of injury increases manyfold. Previous injury is a strong risk factor for the reoccurrence of the injury. As a whole, the structural strength of the repaired structure is less than the normal tissue. It is possible that after the healing of injury, the mechanical imbalance may remain present, but the most important cause of the re-injury could be the proprioceptive deficits. Therefore, the previous injury is a strong risk factor for the reoccurrence of injury. The deviation in the alignments of various segments of body, such as flat foot, cavus foot, bow leg, knock knee, scoliosis, leg length discrepancy, etc., are the known causes of overuse injuries. These factors alters the distribution of applied forces within the kinetic chain and are considered a strong risk factor for overuse injuries. The biomechanical deviations produce concentration of force to some specific areas and make them vulnerable to overuse injuries. Here we can see the different type of biomechanical abnormalities. We can see the flat foot and the cavus foot, and we can see the difference in the force on the plantar surface of the foot, as we can see in the footprints. Adolescent, children and elderly carry high risk of injury due to physiological changes of growth. The adolescent athlete is more susceptible to injury than the pre-pubertal athlete because the circulating androgen promotes the faster development of muscle mass and enhances movement velocity and power. Adolescent athletes also have reduced flexibility due to a physiological lag in the lengthening of musculotendinous structure as compared to the longitudinal lengthening of the bone. It is usually believed that women are at higher risk of injury than the men. The anatomical and physiological differences between male and female are suggested as probable reasons for increased vulnerability of female athletes to injury. In general, the female demonstrate wider pelvis, inward slanting thighs, they have shorter limb length, they have a wider carrying angle, and they are more flexible. They also have less muscle mass and lower hematocrit that may reduce their oxygen carrying capacity. However, The research does not support the view that women are more at risk of injuries. In fact, when the training load and the sporting activities are similar, there appears to be no difference in the rate of injuries between male and female. Psychological makeup of players also contributes to injury. Overassertiveness, aggressiveness, and engagement in high-risk taking behavior appears to increase the risk of injury to the players and also to the fellow players. Inability to cope up with the stress of social life makes the player vulnerable to injuries. Many a time, injury is also used as an excuse for not participating in physical training. At times, it becomes difficult to identify whether the complaint of pain during activity is the sign of malinjuring or a symptom of overuse injuries. After discussing the intrinsic factors, now we shall focus our attention to the extrinsic factors. The extrinsic risk factors, as we have discussed earlier, are the situations where the body is subjected to higher external forces. Fall and collision are the major region of acute injuries, whereas the overuse injuries are the result of repeated application of submaximal load. One of the most important risk factors for the sports injuries is the nature of sports. The movement pattern of sports sometimes becomes the main contributing factor. Running, repetitive action requiring skill and power, fall, contact, and rules of the game often dictate the injury profile of a given sports. In general, in contact sports, the chance of acute injuries are high, whereas in non-contact sports, there occurs a predominance of overuse injuries. Therefore, every game has a unique injury profile. The role of ground on which game is played in inciting sports injuries is well recognized. The artificial turfs provide different hardness, resilience, friction, and inclination in comparison to natural grass. Therefore, injury profile of these surfaces differs significantly. Training on hard surface such as concrete and asphalt can increase the impact loading and predispose to overuse injuries. The different surfaces provide different hardness, friction, resilience, and inclination, and the injury profile of these surfaces differs significantly. Training on hard surface such as concrete and asphalt can increase the impact loading and predispose to overuse injuries. On the other hand, running on a very compliant soft surface increases the cost of running and induces early fatigue that contributes to the increased chances of making errors and hence the injury. The inclination of surface also affects the injury. Both uphill and downhill running increases the chance of injuries due to more muscular efforts required for controlling the movement. Running on cambered track increases stress on the inner leg and predisposes it to the ankle and knee injury. Related to surface is shoe-surface interaction, an important factor in genesis of injuries. Shoes in sports serve three purposes: shock absorption, control of foot motion, and protection from external blows. The requirement of all these three factors are different for different sports. The games with predominance of agility requires better foot control, whereas games involving prolonged impact loading require more shock absorption. Shoes also serve to mitigate the friction of the field. The shock absorption capacity of a running shoe reduces to 30 to 50% within the first 400 kilometers. The further reduction in shock absorption capacity may occur due to perspiration and running on the wet surface. Inappropriate shoes during competition and training is one of the most important factors in the causation of overuse injuries. The wearing a tennis shoe or soccer shoes while running is bound to produce injuries. The poorly designed equipments, especially if combined with faulty technique, significantly increase the risk of overuse injury. Improper size, material, string tension, grip sizes of the rackets are known factors for elbow overuse injuries in racket sports. Protective equipments are designed for many sports on the basis of epidemiological study of injury and biomechanical analysis. Failure to wear them inadvertently or willingly as a mark of courage may cause fatal injuries. The poor quality of protective equipment is also a factor as it does not absorb the excessive force. The protective equipment sometimes provide a false sense of security that encourages the player to indulge in risk-taking behavior. At times, these equipments are misused to inflict injury on the other players. Sports conducted in adverse climatic conditions are known to produce higher rate of injuries. Cold and hot environments influence the metabolic rate and vascular supply to the soft tissue and limit their ability to work efficiently for longer duration. It may also change the playing styles. Heat injuries are known to occur in endurance sports if conducted in hot and humid climate. The most important extrinsic risk factor of sports injury, however, is the manner in which the training for the competition is undertaken. Training errors are the established cause of both acute and overuse injuries. Players pay much attention to the technical and tactical training but often neglect safe training habits such as warm-up, cool-down, stretching, and proper conditioning. Several sports skills such as throw, bowling, swimming, weightlifting imposes heavy load on the body, which itself may be a causative factor of injury, and when these are not performed correctly, the risk of injury increases many-fold. Prior to rigorous technical and tactical training, it is important to ensure that player has learned the correct execution of specific skills and his body is well adapted to withstand the stress of sports. Subjecting a poorly conditioned and novice player to sudden progression in the volume or intensity of workout is the sure way of making him or her injured. The common training errors are practice of this skill without conditioning, sudden progression of volume and intensity of workout, sudden change of the playing surface, and the inadequate recovery. After knowing the risk factors of injuries, now we discuss the methods of prevention of sports injuries. The incidence of sports injuries can be greatly reduced by incorporating the principle of injury prevention in the overall training and competition of athlete. The preventive measures can be grouped under three broad levels of primary prevention, secondary prevention, and tertiary prevention. Primary prevention aims at avoidance of injuries and involves the measures taken before the occurrence of injury. If primary prevention measures are successful, the athlete may not sustain injury in the first place. However, once the injury has taken place, secondary prevention measures in the form of appropriate early identification, intervention, and treatment assumes significance. The objectives of tertiary prevention are restoration of function and prevention of recurrence of injury. Prevention methods can be described as active measures and passive measures. Active measures are the choice of individual which requires voluntary contribution of players, whereas the passive measures are the mandatory conditions set up by the rules that must be fulfilled prior to sports participation. Engagements in safe training habits such as warm-up, cool-down, stretching is example of active measures, whereas wearing protective equipments during play is the example of passive measures. Active measures are the individual choice which can be successful only if player understands the importance of these measures. Therefore, a great deal of education, awareness and sensitization is required to implement these measures. Implementation of passive measures means strict enforcement of rules. Passive measures are usually more successful in preventing injuries than the active measures. A comprehensive injury prevention program requires both these measures. The intrinsic risk factor correction requires the active measures, whereas the extrinsic risk factor amelioration cannot be complete without the passive measures. Correction of intrinsic risk factor is the joint responsibility of players, coach and the clinical support team. Pre-participation examination, treatment and rehabilitation of injuries, correction of biomechanical deficit, practicing safe training habits, and periodization of training schedule are the main measures required for correction of intrinsic risk factors. Pre-participation examination should be done by a team of doctor, physiotherapist and coach for identification of injury-prone athlete. It should be done 3 to 6 weeks before the start of session. Ideally, every player should undergo a pre-participation examination, but for recreational player and injured player, the pre-participation evaluation must be made mandatory. The aim of the pre-participation evaluation is the identification of medical conditions that may limit the athletic participation. It also includes identification of extrinsic factors and the intrinsic factors. The baseline fitness level should be evaluated at this time, and the health risk behavior of the player should also be subject to evaluation during pre-participation evaluation. The component of pre-participation evaluation include medical screening and physical examination for range of motion of all joint, muscle length, clinical examination of the key parts of the body, and the evaluation of the different components of physical fitness. Any identified impairments of the range, strength, balance, endurance and biomechanical anomalies should be corrected or compensated by the appropriate use of orthosis and therapeutic exercises. Many authorities call this step as rehabilitation. A player should be encouraged to develop safe training habit by incorporating warm-up, stretching, cool down and recovery in the training schedule. The third and the most important step for intrinsic risk elimination is the balanced training program respecting the principle of progressive overload, individuality and periodization. Increase in training load should correspond to the induced adaptation. Every individual has different capacity of training and recovery which should be recognized during the overloading. A good training is the balance between stress and recovery. To achieve this balance, the overall training activity of the whole session should progress through the 3 phases of preparation, rigorous workout and rest, each having different goal. To achieve this balance, the overall training activities of the whole session should progress through the 3 phases of preparation, rigorous workout and rest. The elimination of extrinsic risk factor largely depends on the rules and policy. Sports injury prevention is the joint responsibility of all the stakeholders. In order to ensure that everybody involved in sports is fulfilling its assigned role, it is important to have policy and procedures. Formulation of policy and procedures according to the desired objective and their strict enforcement is the most effective methods of injury prevention. Elimination of risky sports behavior and techniques during the play is the most essential elements of the injury prevention policy. The aims and rules of game many a time dictate the occurrence of injury. In many contact sports, technique poses a risk. The unruly behavior of players enhances the risk many-fold. The only way to tackle this is framing the rule for conduct of the game. Most of these sports have the code of conduct to promote safe and fair play. However, a rule can be successful only if it is implemented. In many sports, the rule change that has banned the risky techniques has produced significant reduction in the risk of injuries. In many high-risk sports such as hockey, cricket, boxing, protective equipments are used to shield the vulnerable part of body against impact. These equipments are designed on the basis of epidemiological data and biomechanical analysis of injury. It should be the responsibility of organizers to provide quality protective equipment and ensure that they are worn during the game. The ground on which game is conducted and adverse climatic conditions are the known factor that enhances the rate of injury. While organizing competition, it is important that they are kept in mind. Organizing marathon run in hot and humid weather of June is bound to produce injuries. The appropriate playing grounds should be created, maintained, and be made available for the players. Establishment of a mechanism for injury identification and management is vital to reduce the occurrence of injuries. No prevention program can be successful unless it has ongoing clinical support for treatment and rehabilitation of injury. There should be a mechanism within a sporting environment that ensures periodic examination of the player by a team of doctor and physiotherapist and provide comprehensive healthcare support to injured and injury-prone player. Many players comes from poor background and they cannot afford the cost of treatment. Apart from financial constraints, the lack of professionals and resources at the ground level is the another factor that increases the chance of inadequate treatment of an injured player. As a result, the complete treatment and rehabilitation is seldom rendered to a player, and this contributes to this premature retirement and subsequent reduction in the size of talent pool of the country. Provision to provide support of nutrition and psychology should be integrated in the planning of sports training, as the deficits in these areas not only affect performance but also increase the vulnerability to injury. A player should be provided with adequate and balanced nutrition in consultation with a nutritionist. Psychological analysis of stress profile and teaching of coping strategies are important to minimize psychological stress and maintain optimal arousal level necessary for performance enhancement and injury prevention. The implementation of injury prevention strategies at grassroots level can only succeed when the players, coaches, and organizers have knowledge and faith in them. Sensitizing them about the need of prevention and making them aware about the possible causation and method of prevention is vital. Therefore, sports organization must establish mechanism for creation and dissemination of information through print and electronic media. This information must be created in the local language so that they can be easily comprehensible. The epidemiological research on the incidence, prevalence, and risk factors of injuries are vital for planning any prevention strategies. Many countries have established system of injury surveillance where injury data of players are collected. Analysis of such data provides the basis for rule modification and other prevention strategies. It is important to establish a system to monitor injuries and exposure within the team. This system over the time should evolve to include the aspect of pre-season screening of the physical and behavioral capability limitations. monitoring of at-risk team members, and sensitizing the sports community on the injury management and prevention. Sports is a team effort, and everybody, player, coach, physiotherapist, doctor, sports organizer, they all have the responsibility to ensure that games are conducted in the safe environment. While the correction of the intrinsic risk factor should be the responsibility of the coach, physiotherapist and the player, the minimization of extrinsic risk factor cannot be possible without the support and efforts of the organizers of the sports. In this module, we have discussed the importance of prevention of sports injury. We have seen that sports participation subject the athlete to a variety of external and internal forces. When the magnitude of applied force exceed the structural strength of the tissue due to point concentration of force, the injury occurs. There are various factors that increases the chance of injuries. These factors are classified as intrinsic risk factors and extrinsic risk factor. Intrinsic risk factors reduces the ability of body to withstand the applied force. Reduced range of motion, muscular weakness, proprioceptive deficit, biomechanical malalignments are some of the biomechanical imbalance that increases risk of injury. Other intrinsic risk factors are previous injury, growing age group, and the psychological profile of athlete. The extrinsic risk factors increases the chance of exposure to higher forces. Nature of sports, surface on which game is conducted, shoes, and more importantly, the manner in which the preparation of a sports activity is taken are the important external risk factors. The measures to prevent sports injuries can be divided as active measures and passive measures. Warm up, cool down, stretching, and safe training habits can be included as active measures which require the player's voluntary contribution. On the other hand, passive measures are the rules that must be observed prior to conduct of the game. In the prevention of sports injury, passive measures are usually proved more successful than the active measures. In order to derive the complete advantage of the sports, it is necessary that the sports are conducted in safe environment. Thank you.